Hello and welcome to NHIS in a week where we give you the highlights in the authority and the scheme. My name is Shanice Palm. Now to the headlines. Vice President commends NHIS progress. Final preparations underway for NHIS major digital reforms. And public engagement intensifies at Volta Fair. Now to our first story. The Vice President, Professor Nana Opoku-Agyeman, has commended progress made under the National Health Insurance Scheme in 2025, citing strong membership growth and enhanced stakeholder engagement. She has also called for intensified public education ahead of planned reforms.
Her Excellency Professor Nana Opoku-Agyeman gave the commendation during the courtesy visit by members of the board and executive management who briefed her on achievements recorded in 2025 and outcomes of a recent high-level NHI stakeholder conference.
Being the first female vice president of this country, ably supporting our president, you envisioned a very strong national health insurance scheme, and we have chalked some major successes as a health insurance. So far, all the successes that have been chalked is as a result of your vision. The first one, which was the uncapping of the National Health Insurance Fund, that released 3.4 billion cedis into the health sector, something that was very much unheard of, unprecedented. But thanks to you, you made it happen. As a result, we've had increased confidence in the scheme. For this year, 2025, we have a total number of active membership being 20.7 million, a 2.7 million increase. This has never happened before in the history of the scheme. And this again is as a result of the good and bold decision that this government has taken.
Her Excellency Professor Nana Opoku-Agyeman expressed pride in active membership, surpassing 20 million, and urged broader outreach to uninsured and hard-to-reach populations, while emphasizing preventive healthcare as Ghana advances the free primary healthcare agenda.
I'm happy to note that many more people are subscribing, and I'm even more happy to note that you are making other inroads to ensure that those who are not enrolled will also be served. Because some of us believe that that is what power is supposed to be used for, and that is what government should exist to do. To be able to reach those that, no matter how elaborate your system is, who are those falling outside of it? And what do you do to ensure that they are also served? So it is one thing I'm taking away from this presentation. And I want you to know how very, very proud I am that you are doing that. Congratulations.
Ahead of the planned adjustment of NHI service tariffs, the Vice President encouraged extensive public education to build public understanding and support, and reaffirmed her commitment to reforms that strengthen equity, transparency, and sustainability within the scheme.
The area I wanted us to emphasize, the preventive part.
Yeah.
The public education part. There isn't much we can do, but there's so much more we can do at the same time. For example, for me, sanitation. I want to see this emphasized. Why do we throw plastic everywhere? Is it a question of just banning them? Is it, what is it? And it looks like a small thing, but it's not. So, yes, you can pay the tariffs and all of that. You can add more money to it. Where do we think that money could also have gone? Is it into pharmaceuticals? Is it into what area? So I think even as I know your mandate is what it is, let us be mindful of the things that bring us about in the first place and how we can reduce the difficulties.
Moving on, stakeholders in the Bono East and Ahafo regions have welcomed the introduction of new verification technologies under the National Health Insurance Scheme. They say the move will improve efficiency and curb fraudulent claims.
The endorsement followed a stakeholder engagement in Sunyani, held as part of nationwide consultations on reviewed NHIS tariffs. Participants noted that biometric verification would streamline claims processing and reduce long-standing tensions between service providers and scheme managers. Concerns were, however, raised about access for members without mobile phones, prompting calls for accelerated deployment of biometric authentication across facilities. Officials explained that the technologies have been piloted nationwide and will be rolled out in phases alongside the revised tariffs.
To our next story. Public engagement under the National Health Insurance Scheme has taken center stage at the 2025 Volta Fair. Residents are responding positively to sensitization efforts and the waiver of the 1-month waiting period.
Activities at the whole stadium have seen hundreds of patrons engage with officials to check membership status, register, renew and seek clarification on benefits and services. A key focus of the outreach has been the waiting period waiver, which allows new members to access healthcare immediately after registration. The engagement also highlighted automatic renewals for SNP contributors, ensuring uninterrupted coverage. A visit by Deputy Minister for Food and Agriculture, Honorable John DeMello, further boosted visibility and reinforced public interest in the scheme.
Hi guys, my name is John DeMello. When you renew your NHIS card, it takes a month before it becomes active, but now it's instant. All you have to do is to dial *929# and then complete the process, and instantly your NHIS card will be active. Big ups to the CEO, Dr. Bampo. Big ups to all the NHIS workers across the country. This is what we call resetting.
Moving on. Final preparations are underway for the rollout of major digital reforms under the National Health Insurance Scheme. A trainer of trainers workshop in Tamale has marked a key milestone ahead of implementation.
The workshop brought together regional and district stakeholders from the Upper East and Upper West regions to prepare for the nationwide rollout scheduled for January 2026. Participants were, however, trained on biometric authentication, cashless payments, telehealth services, and an electric pharmacy platform. Officials say the reforms will improve efficiency, enhance transparency, and reduce fraud, while supporting Ghana's progress toward universal health coverage. A coordinated public education strategy has also been developed to ensure consistent messaging nationwide.
To our final story. Engagement with the public and health providers intensified during days 3 and 4 of the Volta Fair in Ho. Activities focused on strengthening collaboration and improving service delivery.
Officials expanded the sensitization efforts under the fair's extended 24-hour schedule, assisting patrons with registration, verification, and renewal services. Engagement also created space for dialogue with health facilities within the whole municipality. Providers acknowledge improvement in reimbursement and claims processing, noting positive impact on service delivery. The interaction strengthened public confidence in the scheme and reinforced partnerships with frontline health institutions in the Volta region.
You should see me rough off. I don't understand. I hope you've been taking your medication. And you are better. Hey, foul. And I say, be pedroni boarding.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh. So you people are here to test my faith, eh? Listen, let me tell you. There's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the Power of Ye, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes, you can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier.
Jimmy Ghana card in a register man be says, yeah.
National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
That's all that we have for you in this week's edition of NHIS in a Week. For more stories, do visit our website www.nhis.gov.gh or do visit our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.